Thank you so much for the introduction, April. I would like, to ask you, I know that we have been listening for a presentation. It's the time of the day in which we might need to stand. So if you need to do that and stretch, please do that. If I have your attention, please give me one clap. Good. Thank you so much. Thank you for the invitation. It's my first time in New Orleans. I'm loving this weather. I think that as a Dominican, I can relate to this weather, so I already feel very welcome. It's very nice also seeing some familiar faces in the audience, people with whom I have worked throughout the years and that I consider my friends. So I really appreciate that. I titled my presentation, Strengthening Community Engagement to Advance Health Equity. And my goal with this presentation is to establish a dialogue with you. And my hope is that you can take this conversation to your communities and actually apply that conversation. So it's very important for me to interact with you, to have an exchange at the end of this presentation and to address your questions. So I would like to invite you to do that, right? I must disclose, and I don't have the clicker, I have it over here. I must disclose that I don't have any conflicts of interest. Here you can see some of the agencies and foundations that have found my work. And my opinions might or might not relate to those agencies and foundations. All my work is collaborative in nature, and I must acknowledge the collaboration of some of my colleagues that I appreciate. My work is multidisciplinary, so I normally work with people that have different perspectives. And more importantly, I work with community organizations. So I must acknowledge some of my community partners. I will be talking about two of those community partners during my presentation, and I want to make sure that you are aware of those community partners. I would like to begin this presentation telling you about why community engagement. I think that I'm in a great room, and something that makes me excited about this room is that we all understand how important it is to engage people in the process of providing services. Whether those are social services, health services, we believe that engaging them and taking them into consideration, making sure that they participate in the process of achieving their well-being is something critical. And I really believe in that. And I would like to encourage you to consider that those people that we want to engage also are part of communities. And by that, what I mean is that those people share social ties, they share perspective, they share common goals. Perhaps they go every day trying to improve their health and their well-being, and that is important. And in those communities, there's a complexity of systems that you probably know better than me, whether that is behavioral health, child welfare, the juvenile justice system. There's a complexity of systems that associate with those communities and that constrain the health and well-being of those individuals. So my point is that in considering engaging those people, we need to engage those communities. We need to engage representatives of all those different organizations, and we often don't do that. And when we don't do that, that impacts the influence of the programs that we put in place, but also the acceptability and the effectiveness of those programs, policies, and interventions that we put in place. And, I think that we need to change that, and that is my main argument today, right? I will show you an example of my work to elaborate on this idea, and hopefully to exchange with you about what is your experience on this. So my work primarily centered around the intersection of HIV, substance use, and mental health. And let me give you some background about the kind of work that I do. I started my career in the Dominican Republic working with people living with HIV. And in 2006, I went to work in New York City. And in this slide, you can see what was happening in New York City at the time that I went to train in public health with the HIV/AIDS epidemic. In 1996, around 1996, for the first time, we implemented like good treatment for HIV, and we can see like a dramatic change in the HIV/AIDS epidemic. And in that change, like we can see how like the mortality drops significantly. HIV becomes like a chronic disease that, like we have great tools for addressing that disease. People can live a long life. But that was the reality only for those people that can engage in healthcare. And that was not necessarily the reality for a lot of like the under-resourced populations that I was very interested in addressing. And at that time, around 2006, we were seeing a shift in the HIV/AIDS epidemic. And the majority of the people that were like getting infected with HIV in New York City were like sexual and gender minorities youth that were like people of color, and also people who ingest drugs. And that was not happening in isolation in New York City at that time. At that time also, New York had like one of the highest population of people who injected drugs. The majority of those were people who were homeless and facing significant barriers engaging into health care. And a lot of those barriers were associated with discrimination and with their behaviors, right? And on top of that, both sexual and gender minorities of color and people who injected drugs have like a disproportionate burden of mental health outcomes, whether that is like mood disorders, substance use disorders, and all these intersection of factors frame their health and well-being and their experience in the communities, right? A fundamental question of my work is like looking into the intersection of these problems and seeing like how these problems interact together. And in many cases, these problems have a synergistic effect. And what I mean by that is like that they impact certain populations in a disproportionate way. And they impact those populations in a disproportionate way because those populations are facing different social conditions that are like detrimental and put them at risk for these health conditions. So when those populations that are impacted by those social conditions face this intersection of issues, they will have a disproportionate burden of disease, right? And I think that like the critical aspect of this is that these social conditions doesn't happen by random. They happen because we have like injustices in our society. They happen because like there's structural violence, such as like discrimination, racism, things like that we need to be aware and that we need to address in our work. And that is the piece that is critical for my work. To what extent do we address those social conditions that are critical and put these individuals like at risk, right? And to what extent do we consider that in the way in which we provide care, and that we consider the complexity of the systems that you all are like very enthusiastically trying to address and to improve for improving like the health of the people that you see in your communities, right? So that is critical for me. When I talk about all these issues, if I talk very generally about like these issues, they sound interesting, but I want like to highlight that these problems manifest in communities. And one community in which I work is Washington Heights in New York City, and I relate with this community in many different ways. For me, this is a vibrant community. It's like an ethno-enclave for Dominicans. I'm Dominican. Like I go and walk like in Broadway, and I can hear like music from my country, see food, see people that have like a beautiful smile, right? So like these contexts have a history, have like a specific composition. So when problems like this manifest in a community like this, we need to take into consideration that context. Although Washington Heights is so beautiful and so vibrant for me, you probably saw In the Heights. If you haven't, I will encourage you to see that movie and see a form of representation of that particular reality that is not completely accurate, but it's like one view of that community. But also in that community, there's significant problems. And let me show you some of those problems. If we go to that community and we take into consideration level of unemployment, incarceration, school absenteeism, you probably will see in this slide how there's like a high density of all those problems in northern Manhattan. That includes Washington Heights, Inwood, Harlem. How many of you are from New York? Can you raise your hand? Good. So in all these slides, you can see how there's a high density of all those social conditions in those areas. So when I try to address my work, it's not a surprise for me that there's a context of inequities that we need to take into consideration. A context of inequities that include social deprivation, economic inequities. There's an absence of service, right? There's a direct impact in that complexity of systems that we are all trying to understand in this conference. And that is associated with the health outcomes that I study. I'm here trying to characterize this community and showing you some indicators about these communities. I spend a lot of time looking for relationships between these indicators and specific health outcomes. But I think that's just one part of the story. And when we go to Washington Heights, we can see a myriad of stories. And that story is more complex. There's problems like this, but there's also a lot of beauty, a lot of things that people do in order to improve their health that we can all learn from, right? So I think that I always feel myself limited in my capacity of understanding that reality. And I think that it's my responsibility to include others in the process of understanding this reality. So because I have that responsibility, I do community engaged work. And for me, this is not an option. It's something that is a necessity. It's a necessity if you really have the intention of improving the health outcomes of those individuals. And I think that I say this because I always live a conflict. I'm an academician, primarily a researcher, but the traditional view of a researcher is you go and you get grants, you implement research, you then collect data, and then I write scientific articles that nobody read, and my work is done. And with the expectation that one day people are going to be using that information in those articles. Every once in a while, they are going to be asking me to come to conferences like this and to explain my work. And hopefully, something is going to change. But we all know that things don't change in that way, right? So our work somehow can be very hypocritical. So I have a different perspective about being a researcher. I think that it's my responsibility not only to collect that data, but to create a process in which I engage others in collecting that data, in which people can utilize that data, that data is in a language that can be conducive to change, and that when we have findings, that we go the extra mile for making sure that we use that information for improving the health of people. I think that my interest is not only collecting data. My interest is collecting data that is necessary for improving the health of people in communities that need that data. So the center of my work is like those needs in those communities. And for me, like that is very intuitive. I think like that is like what academia should be. But, like I'm very uncommon in the academic environment. And I think that is problematic, and I hope that you join me in changing that at some point. This is one of my community partners, and like I work in many different ways with my community partners, right? This is another community in which I work, and many of you might relate to this community. I also work in Lexington. And in this image, you are seeing like the redlining map, a map that is used for allocating loans. And what that shows is like where like the minorities live in Lexington. And it's a map that reminds us about like discrimination. It reminds us that like these social factors that I was presenting before in Washington Heights, are rooted in a history of discrimination. But when I say like a history of discrimination, I'm not talking something that happened in the past and that doesn't happen now. I'm talking about like something that happened in the past, happened now, and will continue happening if you don't do anything about that. And I'm like bringing that to the table because here I am hoping that you really consider in the work that you do how to change these conditions. I'm presenting like two very different contexts, right? But very commonalities about like what drive these disproportionate health outcomes. And it's very important. Let me tell you about my perspective of community engagement. When I work in community engagement, I normally have like a community partner that, to the extent possible, I want like to be an equal partner. And what that means being an equal partner, I mean like I want like somebody who is like completely involved in all the decisions of the work that I'm doing. That is very difficult. That we have equality also in terms of resources, in terms of budgets. That we recognize that we might bring different things to the table, but that we value those different perspectives that we bring to the table, that we create a multidisciplinary process, and that process of participation is systemic, right? Like it involves like all the aspects of the work that I do. And I'm intentionally not calling this community engaged research because I want like to move from the notion of that like my role is just doing the research. Because as I say, my role, I believe, that is doing the research for the purpose of improving the health of the individuals in the communities that I care and that you probably all care. So I would like to encourage you to join me in this perspective because I think that like it's a very critical one. I know that many of you, I know some of your work, I don't know all of you, but I know that many of you do activities of community engagement. Many of you in the room represent initiative for community engagement. I think that like a very valid limitation that we have is that when it comes like to the methods and the effectiveness of those methods, we have limitations in our understanding. What community engagement activities are more effective than others, right? And there's right now a very interesting momentum about like addressing these limitations. There's like some systematic frameworks, a way of thinking about how to approach community engagement that is being proposed, right? So I would like to emphasize how important it is that like we do measurement around our community engagement activities, right? I know that you are like already engaging in many activities that are like very relevant, but until we can make the case that those community engagement activities are related with good outcomes, effective outcomes, I think that we are going to be limited. So in this slide, I want to emphasize that particular issue. And I think also that we are now in a momentum in which there's significant opportunities. And when we take into consideration some agencies, some national agencies and some foundations, we see that they are emphasizing on mechanisms for doing community engaged work. And this represents an opportunity. I think that a significant limitation is that while this conversation is happening primarily in an academic level, many of us are not necessarily participating in the conversation. And I think that makes me question whether this is going to be sustainable and impactful in the long term, right? So I would like to encourage you to participate in this approach. If you have been doing community engaged work for many years, make sure that your institutions participate in this work. There's many elephants in the room, and you probably know many of those, right? I think that there's many elephants in the room when we talk about community engagement because, there's so many limitations that we face for doing community engaged work. As an academician, I can tell you a lot about some limitations that I face. People often come to me and tell me, well, this work is very hard to do, and I fundamentally disagree. I think that it's hard to do if you don't have the right values and if you are not committed enough to having the impact that you want to have in your communities, right? I think that the biggest limitations that I face in doing this kind of work comes from the institutions in which we participate. Comes from finding incentive for doing this kind of work, for making sure that we have time allocated for doing this kind of work, to making sure that those institutions have the intention and the willingness of doing this kind of work. So what I see in most institutions is that right now we are in a time in which there's a rhetoric that is very interesting. Everybody is oh yes, equity, community engagement, whatever. But that doesn't translate into our actions, and that doesn't translate into our criteria for tenure and into the incentive that we have for making sure that we go and do the extra mile and we change the landscape that need to be changed, right? I recently moved from the University of Kentucky to go and join Rutgers as an associate dean. And one of the biggest privileges that I have is that now I sit in the table of making decisions. And I think that is a privilege, but it's also a huge responsibility for me, right? And I bring this to the table because I think that throughout my career, I have been in most situations of being the only one in the table. And when I say being the only one in the table, I mean being the only one because of the skin of my color, the color of my skin, because of my accent, because of the way in which I speak, because the way in which I love, right? And I'm used to that. But I think that what I want to highlight with that is the lack of diversity that we have in leadership roles. And to the extent that, we don't consider that and we don't change that reality and we don't practice shared leadership, I think that we are going to be limited because this bias that I'm talking about that manifests all throughout our society, I directly link it to that fact, to that lack of diversity, to that lack of perspective. So if you plan to do community engagement because it sounds cool, and that is not going to be represented into your leadership structure and your process of decision making, I would like to tell you, maybe like you should consider not doing community engagement activities, right? Because that will be very problematic. So I would like for you to join me in changing your institutions. I hope that like you consider participating, that you raise your voice, that you propose changes, that you challenge structures, that you challenge power, that you participate in the change that like we want to see. I must say, as an individual, and this is very personal, I think that like doing my work is very challenging for me. It's taxing at many levels. Those of you who are like my friends knows how much of a toll this takes on me at a personal level in many cases, right? Because of that intersection of identities that I have. And there's days in which like this kind of work can be very overwhelming. Does any of you relate to that? Yes. Give me a reaction if you do. So I relate to that, right? But when I have one of those bad days, I like to think, well, just because things have been the same for a long time doesn't mean that they are not going to change. And in the communities in which I have worked, I have seen change. And I would like to invite you to participate in that change. I hope that you leave this conference, go to your communities, and participate in being part like of that change that we want to see. Right? Thank you so much for listening to me, and I would love to have a conversation with you. So if you have questions, please go ahead. And they don't have to be questions, they can be comments. Hopefully, like we can have a nice dialogue right now.
In regards to the list of community engagement partners, CMS didn't get noted. And I'm wondering what you think about value-based purchasing and this big movement that we're learning about. What impact, what role? Do you think it could be helpful? Is it helpful? Does it fit into the kinds of problems you're trying to solve?
I think that's a very interesting question. To begin, I think that there's many partners that are like doing initiative around community engagement that we need to acknowledge. So by all means, that list that I present is not comprehensive in nature. I think also, and Teresa can speak a little bit more about like the economic aspect of this, that like we are like right now in a time in which like in many places we want like to incorporate community engaged activities, but it's not clear, like the funding for those community engaged activities, where it's gonna come, right? For example, like many of you might relate to approaches to engage peers. I'm a big believer of that. I think like that the science is solid about like the benefits that have, whether those are like patient peers or like parent peers, et cetera, et cetera. But when we see our national landscape, we see that there's like a myriad of approaches about like how to fund for that, and that limit the effectiveness of those approaches. In many cases, I think like that like what is being implemented is not sustainable in the long term. And I would like for you to take that into consideration, because I guess like my thinking about that is like if we are going to engage into community engaged activities that will be explorative in nature, I would prefer like that we consider like other strategies, right? So that is like a complex issue, how like we are going to be paid for things, how like in our system we consider like mechanisms for funding. I think like that another aspect that is like very problematic is like the multiplicity of approaches that we see in the national arena, and that is another thing that lead to the poor outcomes that we see when it comes like to many issues. Thank you for your question.
Good morning. Thank you for your presentation. Curious for your thoughts. You started with your description of the work in Washington Heights during the AIDS epidemic, and we're coming out of, or perhaps still in, this pandemic. It's some of those same kind of disparity. That laid bare the disparities, the bias within communities that certainly experienced the health and death rates far exceeding what other parts of the population. Certainly coming out of the COVID-19 pandemic, same things are laid bare, right? These disparities show up in health outcomes for people. So what's your thought on, in a 26-year gap there, like, are we getting better? How do you stay hopeful? What are signs you feel like we are maybe heading in a direction where, as these pandemics, as these health issues continue to rise, that we'll be able to respond better, that we'll see fewer disparities in health outcomes for communities?
Yeah, that's a great question. When I think about like my work in public health, I do also work like in the global arena, and wherever like I go, what characterize, like the health status that I see in the work is like health inequities, right? So for me, seeing like the health inequities that I used to see in the Dominican Republic, then moving to New York and seeing other health inequities manifested like in many different ways, right? Seeing the HIV/AIDS epidemic, seeing like how that have been evolving, seeing like the COVID pandemic, seeing now like, for example, the MPS epidemic and how that is manifesting. It highlights for me a context of health inequities. And like to what extent we need to address those fundamental social factors and those structures that lead like to the disproportionate outcomes. And I think like that like we are making progress in terms of that. I think like that we have like we are like at a moment in which we have like a better recognition. There's like a sense of like awareness that is important, and I hope that this momentum stay. I cannot say that like I cannot see change. I have seen change. I have seen improvements. I'm a big believer of the process of organizing. By organizing, I think like that changed communities. Even like if we don't improve the outcomes, like in a dramatic way, just by the process of people getting together and working together in order to address what needs to be addressed in a way that is sustainable and is participatory, I think like that makes a better society. So those are like my thoughts. It's frustrating because like I have been working, so for example, like when it comes to the HIV, I think like that we have like great tools, the same like for drug use, but we keep seeing like significant injustices. And that aspect of injustice is like what concerns me in my work. It's like what drives me to do the kind of work that I do.
Thank you, my friend, for such a wonderful presentation. One of the things coming from a research perspective and not being part of these communities that's important to me when I present data is to actually ask the community what their interpretation is before I go into a presentation of what I think it is. But not everyone here is a researcher, and I'm curious if you could provide us a concrete question or tactic that clinicians or other people from other institutions, not from a research lens, might be able to ask their community to promote that engagement across different sectors.
Yes. See like that, Kim, thank you for your question because like it highlights something very critical. I believe like in the process of me telling you a story about like these communities that I'm presenting to you, I'm like building a narrative. But this is my narrative, right? It doesn't necessarily represent the narrative of the community. So to the extent that we have like a participatory process in which we can like present a more complex perspective a perspective that include like the values of like different stakeholders in the community. I think like that we are able like to do a better job. I see people who do community engaged research. It's like they do the research, they have a partner, and the partner is doing other things. They maybe participate in the recruitment of participants. But I think that that's a limited way of approaching that. And let me give you an example of that. So I do a lot of work, for example, like with people who inject drugs in the context of harm reduction. I do qualitative work, and I go and ask questions to those participants, and we have guides. In my recent studies, for example, like when I approach that population, I approach those interviews with my community partners. I have like a sense of some questions that I can ask, and I have an interpretation of like the responses that I'm receiving from that. But my community partners have like a completely different perspective about that. They know a reality that sometimes escape my perspective. And you know, like doing that have been like a completely transformational experience for me, because I think like that the data that I'm capturing is completely different. If you move from that into like the process of interpreting that data, into the process of like communicating those findings, right? Looking for like the ways who are like most impactful for doing that, I think that like you really have the capacity of like doing an impact. Now the problem, at the same time that I tell you this, is like you know that at the end of the year you're going to be reviewed as a faculty for how many publications you have published, right? So you can write the publications that like 5 people are going to be reading, but maybe like a tweet or like a video or like another form of communication can be more impactful, impacting decision makers, politicians, people in the community, raising awareness about those issues. So to what extent do we rethink the process of like building knowledge? The process of building knowledge to a certain extent, well, not to a certain extent, for sure, is significantly biased. But unless we change that process, I think like that we are going to keep having like the same results. So here I'm saying this and highlighting very important challenges, and challenges for which like, you know, I definitely have an agenda and I want to participate in changing this. But you know, like I know that it's going to be taking a long time. But I hope that you can be more critical about that, and that you participate in changing these structures, because are limiting our capacity of improving the well-being of people that like really need to improve their well-being. There's people suffering because of that, and that is unfair and that is unnecessary, I think.
Rafa, this has just been so exciting, such a great talk. I really appreciate it. I think one of the things that really spoke to me, where you were saying we need to have honest, authentic conversations, share stories, share conversations. And so in response to is CMS, should they be at the table? I think we've been having a lot of conversations without stakeholders who influence, and we have to commit to those hard conversations. And so you've talked about, you know, working with a community partner who helps you gain perspective. I think there's a lot of perspective that we have to work to gain to move things forward. So that's a comment. You said I could make a comment.
Yeah, I appreciate that comment a lot, Teresa, and you know that I'm a really big fan of your perspective. And you know, I think that your comment highlight, to me, for example, like when I think about my work, I'm always like thinking, okay, what is gonna be my main partner in doing this project? And I have like a main partner, but like, doesn't stop over there. Like in that process of doing that work, I want like to make sure that I have like representation of the people that are like impacted by these issues, of like the people that suffer the health outcomes that I'm trying to study. But I want also to make sure that I have representation of the service providers, that I have representation of like maybe members of organizations that can participate in the process of changing the outcomes once like we have the findings of this study. So it's like it should be an orchestrated process, a soulful process, an intentional process in which like we really have like a common vision. We bring people from multiple sectors, right? And then like we work together in order like to doing the research, we write the papers, we do the publications. I also value like having tenure and I need like a job, but hey, like that should not be at the expense of the health of people. That is hypocritical and we need to change that. So to the extent that like we are like a little bit more intentional and more thoughtful and like that, we really think critically about like how we can do better work and work that is rooted in like the needs that we need to solve. I think like that for me is an opportunity. And these are just suggestions. I think like that I can learn so much from all your perspective and from all what you are doing in your communities. So I hope that like we can continue this exchange. And more importantly, that you bring these ideas to your communities and your institutions and that you participate in this change. So thank you so much.